1. Iron deficiency anemia is the most common type of anemia. Causes: it occurs when the body lacks sufficient iron to produce an adequate number of healthy red blood cells. Symptoms: fatigue, weakness, pale skin, shortness of breath, cold hands and feet, and brittle nails. Causes: inadequate dietary iron intake, poor iron absorption, for example in celiac disease, chronic blood loss, like gastrointestinal bleeding, heavy menstrual periods or increased iron demand during pregnancy. 2. Vitamin B12 deficiency anemia. Causes: insufficient dietary intake or impaired absorption of vitamin B12, crucial for red blood cells production. Symptoms: fatigue, weakness, pale or jaundiced skin, numbness or tingling in extremities, and neurological symptoms if severe. 3. Folate deficiency anemia. Causes: inadequate dietary intake or impaired absorption of folate, vitamin B9, which is essential for RBC formation. Symptoms: similar to vitamin B12 deficiency anemia, fatigue, weakness, pale or jaundiced skin, numbness or tingling in extremities, and neurological symptoms. 4. Hemolytic anemia. Causes: hemolytic anemias result from the premature destruction of red blood cells due to intrinsic within the RBC or extrinsic external factors. Symptoms: fatigue, jaundice, dark urine, and an enlarged spleen. Thalassemia, a group of inherited blood disorders that lead to reduced hemoglobin production. 5. Autoimmune hemolytic anemia. The immune system mistakenly attacks and destroys red blood cells. 6. Aplastic anemia. Causes: aplastic anemia is characterized by a damaged or dysfunctional bone marrow, leading to a decreased production of red blood cells, white blood cells, and platelets. Symptoms: fatigue, weakness, frequent infections and bleeding tendencies. Causes: idiopathic unknown cause, radiation, chemotherapy, exposure to toxins, or certain medications. 7. Chronic disease anemia. Causes: chronic diseases like chronic kidney disease, inflammatory disorders, like rheumatoid arthritis or cancer, can lead to anemia as a secondary condition. Symptoms vary depending on the underlying chronic illness, but often include fatigue and weakness. 8. Hemorrhagic anemia. Causes: hemorrhagic anemias result from acute or chronic blood loss, either externally, e.g. injuries, surgery, or internally, blood loss, like gastrointestinal bleeding, heavy menstrual periods. Symptoms: fatigue, weakness, pale skin, and signs of bleeding, e.g. melena. Hematuria treatment, treating the underlying cause of bleeding and if necessary blood transfusions.